Okay, so tell me about the procedure that you had done, and tell me a little bit how you felt before, and now how are you feeling after?
Well, I had a lower lumbar surgery done with minimal invasion, and I was a little leery about the minimal invasion because I've had many surgeries that they cut you open, so I knew how those ones were. But this one, I healed so much faster. I am up and about. I feel like I have life back. Prior to surgery, I could not stand, not even for 2 minutes. And I was literally feeling like my body was breaking in half. And if I didn't get horizontal within like 5-10 minutes, it was tear worthy. And I had twins 11 years ago, and they have never seen me not in pain, not walking with a cane, not arched over. Mommy always limited what we could do. So my kids had restricted with fun because mom couldn't go and do. And now I'm a new mom, and every day I am getting so much better. And my boys, I mean, the one looked at me and he's like, Mom, are you not in pain? And it was like just 2 weeks after surgery, so I was still in pain, but he just noticed I was so much lighter and happier and a different person, all because the pain is going away. Dr. Kim gave me my life back, and he is giving me the ability to be a mom again. I cannot tell you enough about how wonderful this surgery was and how much freedom it has given me. And I'm only a month post-op. I've got so much to look forward to because I'm getting better so fast, and I can't believe it. It's a miracle.
So you're a month out, pretty much to the day, I believe.
Yep.
And I was in when you came in for your basically right before your surgery. I think it was the day before your surgery.
Okay.
And I remember you in so much pain you could hardly stand up.
Yes.
And then tell me a little bit about the day of the surgery. Do you remember when you first woke up? How did you feel?
I felt good. The constant low back pain was different. So I knew it was post-operative pain. It wasn't my back that was aching. And normally I guess you're supposed to stay for a couple days after surgery, but I felt so good. I'm like, please, can I go home? I mean, I've had so many spinal fusions. I know the routine, and because I was doing so fabulous, I got to go home the next day. And I attribute that to the minimal invasion. My last surgery that was not minimal invasion, I actually had to extend my stay. It was that tough.
And your prior surgery, that was another fusion.
Yep,
that was done
cervical,
at
a different doctor.
Yep, different doctor. You had a cervical fusion there.
Yep.
And that outcome, what was that like?
That one gave my fingers and stuff back to me, but it gave different issues. And now I found out that what that guy did has to be redone. So going through all that extra pain, having to be an extended hospital stay, I mean, it was not good. And I mean, I've got scars here and on the back of my neck and on my hip because they took bone. I mean, that was a horrible surgery, and I have to have it done again.
Okay. And what would you say to people who are feeling kind of like you did a month ago? What would you say to them today?
Oh, don't hesitate. Come in, see him. I wish I could hug him. And I mean, he's given me life. I cannot explain. I had a cane. I was mentally able to do everything, but physically hesitate. I mean, come get your freedom. You know, come get life. I cannot tell you how amazing I feel. I wish I would have found him years ago.
Great. Well, thank you so much for the interview.
No, thank you for letting me tell you it. He's amazing.